Football and other high-contact sports in full swing now. Athletes are more susceptible to serious injuries.
Yeah, nobody wants to go to the hospital. So how can you keep young players safe this season? Dr. Norman Bubendorf, a board-certified physician from Hand Surgery Limited, is here to talk about the most common hand and wrist injuries and how to prevent them. Thanks for being back, Doctor.
Glad to be back here
Love
again.
the tie.
Yep,
Thank
fantastic.
That's like
the
right
hands.
for the
Have to wear
theme,
the
isn't
hand
it?
tie here.
It's how many
Perfect.
hand ties do you have?
One.
And we shouldn't say hand tied. We mean like hand tie. You get it.
Yes,
there we go.
there it is. Love that.
There are several other models of this, but this is the one I like the best.
I like that.
So this time of year, there's a lot of sports that are going on, and that's where, you know, a lot of the injuries that you tend to see come from. What kind of sports are causing injuries this time of year?
Of course, we have baseball just finishing up. We have basketball just starting, but football is the big sport, as you know. Particularly with the some of the hand injuries, as you know, with Clay Matthews with the Packers. He had a serious hand injury, and it's lucky that he got an expert wherever he was being treated, because this sort of injury, from what I understand, I don't have any insider information, but from what I understand, needs to be fixed surgically, so it couldn't be treated in a cast.
What should be done immediately when someone has an injury that's sports related?
Okay. Probably the first thing to do is, I mean, if you're there, just see really what happened. Was it a ball thrown by a 4-year-old, or was it thrown by a professional quarterback? So, you know, how intense was the injury? I mean, how much force was there? So you just need to take a look at it and see if there's any parts that are out of position. Is it dislocated? Is there lots of swelling? And so that's probably the most important thing, is just take a good look at the injury. If it looks, and this sounds simple-minded, but look at your other hand and compare one to the other. Are there certain joints that don't work? Are there certain bends or deformities? And that's one of the most important things you can do, is just look at the injury. They use the acronym RICE with rest, ice, compression, elevation is always a good idea.
Say that again. I think that's a really great thing to remember, the acronym RICE, and it stands again for?
Stands for rest. In the ice is the second one. C is compression, such as with an ACE wrap, and the E is elevation. If you can keep it elevated, you'll have much less swelling.
So with injuries, you know, because I think sometimes with backs or things like that, you hear ice and alternate between ice and heat. With hands, you generally always want to ice?
Usually for the first several days at least, ice is better.
Okay.
And then usually what we recommend is, if your hand isn't almost normal by about 2 or 3 days afterwards, then you probably should see someone that's an expert in the field.
Yeah, how do you know when you should see a hand surgeon specifically?
That's actually a kind of a hard question. I mean, some injuries you obviously know are very minor. Some injuries are so severe there's no doubt in your mind that you should go to emergency room. It's the middle ones that are a little much of a problem sometimes. If you have when to go to an expert, once again, if you have a joint or something that doesn't look quite right, that doesn't look very well after, say, several days or so. Also, I've found that if there's any bruising, very often that means there's a broken bone underneath there because of the blood vessels in the bone. If there's bruising in there, that's probably a better indicator of whether it's broken rather than whether you can move it or not.
What if you can just feel that bruise, but you don't necessarily see it? Does that make a difference?
Probably so. I mean, if you can see it, then that's a pretty sure sign. But if you have any doubts, particularly after 3 or 4 days and it's not getting significantly better, then that's a time to see someone that can take care of it.
Because some of these injuries will require surgery, right?
Correct. At the Hand Surgery Limited, we see the only injuries we really see, and other chronic injuries for that matter, are upper extremity injuries, where the name is hand surgery, but it extends clear up to the shoulder.
So some of them, or a lot of them, require surgery?
Some do. A lot of them just need some splinting. Sometimes they just need some rest and therapy. We have therapy department at our offices. We also have x-rays on site, so we can determine whether there are any fractures there.
I think sometimes it's just that peace of mind of knowing what's going on, because once you have an injury, and if some of that pain persists, or if you kind of keep noticing that nagging feeling that it's just not healing correctly, it's nice to just know, hey, this is just a regular injury, it's going to heal, or no, you need some further therapy, or you need somebody, you know, you need to do some more work work on it. I think sometimes
I
that
agree.
peace of mind, having a specialist, especially when your bodies are so young and changing still, is so important.
That's true. We treat kids, we treat small children, we treat weekend warriors. So it's not just young kids with injuries. We have, guys that are too old to play basketball, basketball. And
Oh, yeah.
My first job after college, I worked at a gym, and I cannot even tell you how many injuries happened on that basketball court on the Wednesday nights when all the dads got together and played like they were still in high school. That's when there were a lot of those injuries. So.
Yeah, for sure. And just to recap, we give the information for Hand Surgery Limited. They, of course, treat hands. It's the whole upper extremity. It's
Correct.
the hand, the wrist, the elbow, even the shoulder. So here's how you can reach the specialist at Hand Surgery Limited, 414-453-7418, or go to handsurgeryltd.com. Good to see you this morning, doctor. Thank
Nice
you.
seeing you again. Thank you both
Appreciate it.
again.
Thank
Bye.
you.
Love the tie.
Right.
Yep, it's great.